Hello, everyone. Dr. Siddiqui here. Today, I have joining me an amazing doctor from Germany, Dr. Murat Dagdelen. Welcome.
Hello.
Thank you so much for joining us today. It's an absolute pleasure.
It's a pleasure for me. I'm very glad to make this conversation with you. Thank you very much.
Absolutely. Before we get started, can you share an interesting story to our viewers?
Interesting story. We have a lot of interesting stories. If I look back, the last week I had a very big man in my office, really 130 kilogram, and 2 meters tall, and he was in my office for rhinoplasty consultation. But rhinoplasty, you know, is one of my favorite operations in my office. He brought some pictures of his simulated nose. Normally we simulate the nose with the patients, but he came with his wishes and a desired nose form, and I saw a simulation of very fairy nose, you know, we call it fantasy nose, very small bridge on the nose, and very small nostrils, like a fairy, and it was very interesting and very strange, his desires, and there you can see how different the ideal of beautiness can be. But in this case, you have to be very professional and have to talk to him with a doctor, and I hope I could help him, but I'm sure that he will go to another doctor and find another one who will do this for him, but I refuse to operate on him. A fantasy nose to a man 2 meters tall, it's not appropriate in my eyes.
It's a very interesting story. So can you tell us a little bit about who you are and what you do? You did tell us, you know, you like doing rhinoplasty. So what is your specialty and where are you in this process?
Yes, I was born 42 years before in Germany. I'm Turkish ancestry. My parents are from Turkey. They settled or immigrated to Germany in the 70s, and I was born here. I go to school here at the university. Now I'm a plastic aesthetic surgeon and hand surgeon. My hospital career as a leading doctor, it was until 2050, and since 2016 I settled to Dusseldorf, and I'm running now a private practice called Diamond Aesthetics on my own in the heart of Dusseldorf, and I studied in Germany and Switzerland and in Turkey too, and I had some fellowships as part of scholarships. I was in Rio de Janeiro, I was in Shanghai, Beijing, and also Newport Beach for a short time. And as I work here since 4 years in Düsseldorf, I've become also to one of the top 3 surgeons in my city. And this is honored me from Yamida. I don't know if you know Yamida in Germany, in America. It's the biggest evaluation platform for patients in Germany, and to become in a short time of 3 or 4 years to the top 3 in Düsseldorf, it's a great honor for me.
That's amazing. That is absolutely incredible. I've seen a lot of your work on your Instagram page, and it's just fascinating to see what you do. Tell us a little bit about the daily things that you encounter. You mentioned the rhinoplasties. What are other things that you encounter on a daily basis?
Yes, like we are a surgeon, we can't be all the time as you work alone all the time in the operation theater. Half of the time I'm in my private practice to make consultations with the patients, with new patients, or make dressings or controlling the operated patients. And my favorite 3 operations are rhinoplasty, functional and aesthetical. The second is breast surgery, like breast augmentation or breast reduction, mastopexy. And the third one, liposuctions or body forming, body sculpting with lipofilling of the breasts, or like Brazilian butt lifts. You know, from head to the teeth, we are doing toes, we are doing everything.
That's amazing. I've seen the different types of liposuctions. Do you do the ones where they do an outpatient setting, or is it under general anesthesia in the OR?
I always do it under general anesthesia in the OR, using the tumor sense liposuction with tumor sense. Firstly, we put liquid inside the body and waiting for a few minutes, and then take out the fat. I do it with the vibration liposuction, and sometimes with the laser. And that, okay, if you take out only 2.5 liters, then you can make outpatient operation. But we take out more than 3 or 4 liters, and therefore it's better for the patients, safeness for the patients, to let them one night stay at the hospital in order to help them if something is with their blood circulation or something else.
That's amazing. So tell us a little bit about your journey. How long did it take you to become who you are today? I mean, you're a super specialized surgeon that does so many amazing things. So how many years of your life did you have to spend in school and training in Germany to be able to reach what you're doing today?
Oh, a lot of. If you count, I was starting with the school at 6 years, around 6 years old, and the end, the finish of my university career, I was 26. You see, 20 years I was at school and the university, and after it you also need six further years in the hospital to get your specialization. I've did this 6 years in Germany, and after it you can settle down, you can make open your private practice, but I stayed there to become a leading doctor in the hospital, and I stayed there the first 3 years more to get my hand surgeon. So I get 2 specialties, the hand plastic and aesthetic surgery and the hand surgery. And afterwards I spent more time, 3 years at the hospital, to become more familiar with all the operations, with reconstruction of cancer breasts or amputated hands or fingers after injury or burning defects. That are this part of the plastic surgery is more than the aesthetic part. The aesthetic part is only a small part of plastic and reconstructive surgery. But if you settle down your private practice, then you only treat aesthetical operations, and therefore I wanted to learn and to do everything else before I go to the last period of my life of plastic surgeon in a private practice. And my private practice, it's not possible to do the 10 or 12 hour long operations of reconstruction of hand, fingers, or breasts. Therefore, I stayed there at the hospital after my specialization another 6 years. So you can say it was over 30 years to be there now where I'm now.
That's amazing.
And the journey is not easy. You know it also. You have 70 hours a week working on duty at night and day, and it's not easy to become a doctor. You know it as well as I do. And sometimes people asking me in Germany, I'm 20 years old, I want to make the operations like you do. How do I have to do that to become in a few years in the same position as you? You have to talk to them, and you have to tell them that you have to go to university, you have to work as a surgeon in a hospital, became specialized, and then you can do this beautiful stuff, what we do now. But it's a
It's not an
long
easy.
journey. It's a long journey, yes.
Absolutely,
But
absolutely.
it is hard work. It's also, if you're a hard worker, then you get rewarded. And I was strongly supported by my ex-chief in the hospital, and that's the reason that I'm here now where I am now. Without his strong support, it would not be so easy to become. This was what I become now.
That's very important to have that support system.
It's,
Like you said, it's a
yes, it's
very
very important. But
process.
yes, you have to choose the right jobs, and if you're a hard worker, then you have to get supported by your chief, and this is your reward for the hard work.
Absolutely. So what would you say throughout these long years was the biggest challenge for you? What would you say was something that you really had to keep on pushing yourself and say, you know what, I'm going to get through this to get to where you're at today?
Okay, I can't understand you very well, but if I have to talk about the negatives of the journey is that you have no time for your family, for your friends and your hobbies, and you have to decide, do you want to become a good doctor, not only good, one of the best, then you have to invest more time, or do you want to make more work-life balance? It's also okay, but you can't work only 40 hours like other worker, and to get the one of the best. To be the one of the best, you have to work more than the others. And it's very interesting because we are black-haired here in Germany. We're also immigrants. And my father told me all the time, my son, you have to work twice than the others because you're a son of an immigrant. And that works.
Mm-hmm.
If you work twice, then you get honored.
Absolutely. Yeah. There's a lot of sacrifices, and then there's always that component where, you know, when you do come from immigrant families, it's going to be a little bit more challenging because we have to navigate the way by ourselves, and it's twice as hard. You have to work twice as hard to get to what, you know, others do. So I think it definitely makes it a little bit more challenging.
Yes, it's a big journey. If I don't know if I would take the same career if I was born in Turkey or in Iran or somewhere else. I don't know, but in Germany, everyone is in the school, in the educational career, the same, and then hard workers come farther than no hard workers.
Absolutely, absolutely. So you mentioned a little bit about, you know, going into private practice. How would you say, is it easy to go into private practice, or what were some of the challenges that you encountered, and then getting the clients and then basically just becoming the best at your job? How was that journey like?
Well, the market is saturated in this area, in many areas, plastic and aesthetic surgery. In my city, in Dusseldorf, you have almost 80 aesthetic surgeons working there, and they all are saturated in the city, and it is saturated. And to become a good career, and you have to be the best. This is very, very important. If you are not the best and you come to a city where 80 other people are working the same like you, then it is not easy, I think. And if you settle as a practitioner, then you settle in a big city, and there are the others too. And there are some clinics and practices are closing every year. This is a sign that it's not easy. But like in other areas, the quality prevails. If the quality is good, then the patients know it and it works. If not, then you're going to fail. And if you make a private practice, then it's not enough to be a good doctor. You have to be a good seller. You have to sell your work. You have to be good in economics. You do not learn this at university or school. You have to learn it in your way. And after leaving the hospital, you're not an employee, you're an employer, and you have to know everything. You have to buy the implants. You have to search new employees. You have to be 24 hours on duty for your patients. It's not easy, but it's okay. I think it's one of the best periods in my life. You have to be with your heart. You have to work with your heart, and that's, I think it's the biggest deal you have to do in your life.
Absolutely, absolutely. So we
You
talked
have
about
always you have competition.
yeah.
You have always competitions, like in every field, and the competition doesn't sleep, and so you have to be always better and better. So we have also we have to attend congresses and workshops, and I like to visit them. It's very good, and like in the hospital work, I taught a lot of students, and I still continue teaching students in my practice. And that's the way to learn and to teach others. That's the way, I think, to become more and more better. If you can teach something, then you're professional in that.
Absolutely, absolutely. So we talk about some of the, the difficulties of going into medicine, whether it's, spending years and years of your youth and studying and the challenges. But what are the good aspects of medicine? Because there's a lot that, makes medicine a fulfilling job. So what are some things that really have inspired you to, go into medicine and stay in medicine and do what you do?
If I think to the past, I think there's nothing I would have done differently in my education career.
Mm-hmm.
This is my passion, to be a doctor. Firstly, starting with the university career, I didn't know that I would become a plastic surgeon, but firstly I wanted to be a pediatrist. I wanted to help children and the small children. I did my first degree, my promotion, my doctorate promotion in pediatric oncology about neuroblastoma. It is a child oncological problem, sarcoma, and I've seen a lot of suffering children. And it was very sad for me to see the suffering children. So I decided not to go to this field of medicine, and I visit my fellowship in a big plastic and reconstructive surgery in Stuttgart, and then I saw the noses and I fell in love. Nose surgery, rhinoplasty, and so I stayed. Or my vision was to become a plastic anesthetic surgeon. But firstly, I wanted to be a pediatrist and to help the children. But it was not easy for me to see the children suffering and dying. Now I'm with almost healthy people which do not like their noses, lips, or breasts. It's okay. They leave the practice with a smile in their face, and this is okay.
That's the biggest
I
thing.
like make I like it to make the people satisfied and glad.
Ab- Absolutely. That's amazing. So what are some advice and tips you have for students that want to pursue your footsteps, that want to become an amazing surgeon like yourself? What would you say they should, there are certain things, whether it's the work-life balance, whether it's, you know, doing well in university, what are some things that worked really well for you?
Yes, how I mentioned, the problem is for my new colleagues with plastic surgery is always that is mistakenly perceived by them as only aesthetic surgery, but it's not only aesthetic surgery.
Mhm.
First of all, it's the plastic and reconstructive surgery. And in my opinion, if you are good in the reconstruction of an organ or the body, if you can reconstruct it after illness or injury or burning, then you can reconstruct very well the aesthetic part of it. And therefore, my recommendation is that they have to stay in a clinic for a long year and to do everything of the plastic and reconstruction and burn injury. And after this, they can, if they are very professional in their work, they have to choose one field of aesthetic surgery and get specialized in it, and then they can go to the private practice. Because I see some colleagues, new colleagues, they hurry up 6 years in a clinic, and they saw only one or two breast augmentations and no rhinoplasties in the hospital, and then they settle down to a private practice and put it on their internet. I'm doing breasts and nose and everything else, and they learn in the practice to operate on aesthetic, and that's not so good, I think, for the patients. I can't operate anything on a patient without learning it on a cadaver or seeing it at Congress and assisted to professors. And some people they think it's so easy to do marketing on Instagram or Facebook and take the patients and operate on them and learning by doing. It's in my eyes, it's not learning by doing. It's
Mhm.
a profession, and you harm a healthy body. You know, you harm with your operation, and therefore you have to give your best, and you have to be very perfectionist to get the
Absolutely.
best result. Yes.
Like you said, you have to master that art. You can't just be doing a little bit of everything and just learning it in the process. You have to master it before you can use it.
Yes, yes, you have to master everything. My biggest field is rhinoplasty. I'm here specialized in rhinoplasty, and I'm an expert of rhinoplasty. But I had a very good educational career in the hospital that I've learned everything. I can do every part of the aesthetic surgery. Um, but this was the honoring of my ex-chief. He taught me everything. And we saw a lot of aesthetic in our clinic. It's not normally that you have so many aesthetic cases in a hospital, but we had, and we learned everything. And I stayed there to learn more. And what I like mostly is the rhinoplasty, because I don't know, because of my ancestry. I don't know the Middle Eastern noses. We have all bumps on our noses, and we have thick skins, and we are, we are nice people. We are very beautiful people, but mostly of them we have problems with the noses. I think that's why I love also this field of.
Absolutely. Well, can you tell us a little bit more about these rhinoplasties? I mean, what are the typical patients? And because there's, like you said, there's the aesthetics, when you do it for just the purpose of aesthetics, and then there's functional. Some people have deviated septum. Some people aren't able to breathe properly that require rhinoplasty. So can you give us a little bit more insight into this?
Most of the people coming to me, they don't know that they have functional problems. They're coming because of their aesthetic view, aesthetic problems. And looking in their nose with the specula, I see this. I think 90 98% of the people has deviated noses, deviated septum, and big concha. But in my practice, firstly they come because of their aesthetics, and I tell them always, I don't only do the aesthetic. For me, it's very, very, very important to operate first on the functional part of the nose, and getting the inner nose wide as possible, and then I can make it all smaller from outside. But if you have very small nose inside, then I can't do a very fancy and fine nose. I have to adjust the outer nose to the inner nose, and the typical patient is in my office very young patients now. They are from 20 to 45 and 50, but most of them are young people. And because of the selfieism, you know, it's the selfie pictures they taken for Instagram and Facebook. Always of the phone, the nose is in the center of the picture, and it's always a little bigger than it's for the others. But since the social media, we have more and more people coming with aesthetic problems with the nose. Because I asking them always, why do you come now and not earlier, or what's your thinking about it? And a lot of them, 20% of them, they said, before the selfies, before social media, I had no problem with my nose, but now I don't like the pictures from here or from there, from the profile. And it become more and more. And normally it's people with humps on their nose, broad nose tip, and a hanging columella, and they are not suffering from breathing.
Absolutely. Well, this is absolutely amazing. Do you have any other thoughts before we close up? Anything else? Any advice or tips for our viewers who are watching?
My advice is for all the patients who or the doctors who are hearing us. It's very important to operate on the patients or treat them naturalness. I don't like the fake knees and the fake lips and fake breasts. It have to be. It should always look natural in my eyes. My patients, they go out after rhinoplasty or body sculpting, and they come back and say, "Doctor, no one realized that I had a rhinoplasty." And I said, "Okay, well, that's the best. If they don't realize that you had a rhinoplasty or upper lid blepharoplasty or lip augmentation, then it's the best. If they don't see it at the first sight, then it's natural and it's not fake or not too Barbie-liked nose. Then I'm very, very happy to hear this. If they stay natural after this kind of operations, it's the people can have the desire, like the man I mentioned before, to have a very small nose and a big face. But as a doctor, you have to make a point, and you have to tell them that's not just in your face and in your behavior. I can't give a African girl a nose from a Caucasian girl, because it does not fit in the ethnic face. And I think this a famous example is Michael Jackson. You know, he was a black man with a black nose, and they operated on him, I think, about 20 times. It's a great honor to operate on Michael Jackson, but I think the 10th or 11th doctor had to say, okay, stop, Michael Jackson. Now your nose is okay. If we operate on you again, then you will fail with the nose. And this is what happened. I think there were doctors who sent them to, who said no until now, and then not far, but he found another doctors to do that. And that's it's not a problem from Michael Jackson. I think it was a problem for the other doctors, for the colleagues, because everyone who see him or saw him would have said, no, Michael, your nose is now correctly, aesthetically, stop with it. If you have colleagues who are operating to earn more money and money and money, then you fail. You can see some stars in America or Germany who are operated too much on their face, and you can see from 100 meters that they are looking fake and not natural anymore.
That's true, absolutely.
That's my advice to my colleagues. The advice to my colleagues is to say no if it's too much.
Mm-hmm. Mm-hmm. Absolutely. I think that's great advice for both our patients and audience to know that, you know, they have to have realistic goals. And, you know, and nowadays everybody wants to look good, but I think they don't want to look plastic, or they don't want to look like they've had things done. So that's a very interesting point.
Yes, we always have to respect the individual body.
Mm-hmm.
And another advice for my becoming colleagues is they have to learn more in economics, not only in medicine, because this is very important to later on start another company or your other private practice. Is always very, very important to know you well in economics. In order to stay there, in order to get survive. Without economics, only with operation, you can't survive in a private practice. Then you can stay also in the hospital.
Mm-hmm. Absolutely. Well, thank you so much, Dr. Dagdelen. It was an absolute pleasure talking with you and listening about, you know, your journey and the amazing things you do.
It was a pleasure for me. Excuse me for my English. It's it's not my mother language, but I tried my best. I hope you understand me well.
Absolutely. I think it was beautiful. We appreciate you taking the time to talk to our audience and to give us a little bit of an insight into your life.
Okay, thank you.